We do apologize for that technical issue. We do apologize. But guess what? We are back. My name is Dorothy. Health and Wellness every Saturday from 8 to 9. I do have Dr. Kanyike. And before we had that technical glitch, we're talking about how self-medication affects the antibiotic, how it attributes to antibiotic resistance. Yeah. Yes.
Thank you so much. As I was saying, I wanted to borrow some childhood experiences and maybe daily experiences to try and explain this to our viewers. So when we talk of antibiotic resistance, of which antibiotic resistance is only for antibiotics, which is one class of drug, but there are others like antimalarials for malaria, antifungals for fungi, like Lugumu, Miguna, and all that. So the right term would be antimicrobial resistance because it takes all that into one bracket. So what that means is that a microorganism is resistant or is not able to be killed by a medicine that was able to kill it before. So they have developed resistance to this medication. And how that comes about in the realm of self-medication is that we expose these organisms to inappropriate doses of medication, or low doses, and give them a chance to fight back. And I was trying to borrow that analogy of movies whereby this murderer enters a home, once maybe money, tries to kill the father, kills the mother, and then there is this little boy or child that is, maybe hiding somewhere, or they feel pity for them and they're like, I've left that one.
That one won't find us.
That one has
won't
nothing,
remember us.
has nothing on me. But this child has looked at them critically. They know, most times they have a very specific tattoo.
Yes.
So they know that is the guy that killed my parents.
Yes.
So they grow up, they go training for this guy, searching about his whereabouts and all that. And in the end of the movie, they come back for the guy like very badly. They have trained, they have all the techniques. So this is really what happens in the body when we expose these microorganisms to low doses, inappropriate doses that are not able to kill them entirely. It is going to clear off some, but those that have remained, that have been a little bit resilient, and you've not been able to take enough to kill them, they get exposed to this medication.
Wow.
And then they get a chance to fight back, find ways of going around them, and then they develop the resistance. Now when you get this microorganism causing an ailment or an infection to you later in life, or to another person probably who could have transmitted it to, even if they took now this medication in the right dose, it is not going to be able to work on the microorganism because you gave them a chance at the start to become resistant. And that becomes very problematic because most of the drugs that we are misusing, taking in low doses, taking half tablets, sharing between kids,
dividing.
Yeah, they are the cheap, readily available drugs.
Drugs, yes.
So when you get a very simple infection, as simple as a urinary tract infection, even malaria drugs are becoming very resistant nowadays. We are not able actually to treat you with these simple first-line medications that are cheaper. What does that mean? That means that something simple is going to put you down, waste your resourceful prime time you would have used to maybe work. And something. So you are ever in and out of hospital, and then you are going to need higher classes of antibiotics, which higher classes come with higher price, but also come with a high, a worse profile of side effects. So you are going to spend more. You are taking a drug that has more advanced events because you are not able to use the cheaper, readily available option well. So you have to pay the price in turn. And that really affects everyone.
Okay.
It affects you as a patient, it affects us as a doctor, but also affects the entire
nation, health sector.
Yeah.
That is very true. I would want to mention a few symptoms or diseases that we usually run to, and before you know it, you're killing yourself. Headache, flu. Now people treat flu como it's COVID. You're not sure whether you have, whether it's the eyes itching, or so. I think there are very many. But you could tell us the dangers of misdiagnosing with different antibiotics. What could be the dangers? Now that I've swallowed my Panadol, now I've been given anti-malarial drugs. What could be the dangers now for me after that?
Thank you so much. You hit it on flu and cough especially.
Yes.
We have something called the common cold. The Senyiga, that Lubiamila, like the usual flu that we get, that is usually viral. But usually, always people run for the antibiotics. Amoxicillin, and you know, amoxicillin has that double color. They will always go to the pharmacy and like imperi capsule, so they always feel very comfortable when you've given them different colors and types of medicine. That's when they feel that this doctor or this Musao knows what is going to, what is doing. So most of this common cold actually are caused by viruses, which are self-limiting. Like the body is able to fight the virus. So all you need to do is support it. Take the juice, the orange juice, water, keep hydrated, keep the body active, just to support it to fight back. And then you end up taking antibiotics that are not necessary, and you are exposing the other organisms that are in the body, because we have those that live harmoniously with us in a kind of relationship. You expose them to unnecessary antibiotics and they are developing resistance. But coming to the dangers, I would like especially now to use like a context of malaria.
Please.
So a kid gets malaria, and usually these kids experience very bad side effects of malaria because they have low immunities and all that. So at the first shot, you have to treat it very well so that you don't, give it that leeway of causing complication. But usually, especially the mothers do, even my own, because the home I grew, we had a tin at our home pharmacy in the what do they call it? A chibo. The thing. So everyone knew where the chibo was. Yeah, the drugs were. So headache, fever,
Panadol
equals malaria. Coartem is out. Those days there was what was it? Fancida, chloroquine, and those things. Yeah. So you give the child, and they will always get better. Like after 1 or 2 days, and then that will be the end of it. Then you are giving opportunity for these microorganisms to multiply in very huge numbers, and before you know, this child has come with cerebral malaria. Like the microorganisms have grown in large numbers enough to invade the brain and every other part of the body. So a kid comes, they have cerebral malaria, it has shattered the kidneys, it has interfered with the liver, and something as simple as malaria is killing a lot of our children.
Very true.
One, sometimes because they can't access really the proper treatment, but other times because we do self-medicate, and by the time we come to hospital, it is really too bad. So it is costing life. But in the event that fortunately it hasn't costed you life, it may cost that kid quality of life.
Medication.
Yeah, quality of life later. If it goes and affects his brain really enormously, it may impact on his cognitive function. But it is also infringing on your pocket as a parent. If you are to come at Mengo Hospital, where I work, or these other private sectors, you may really have to part with unhandy amount of money to treat this kid for 10 days to 2 weeks. So it really becomes very problematic. So it is really very important that we seek medical professional advice.
Okay. Thank you so much, Doctor. We are still in the studio with Dr. Kanyike Andrew, all the way from Mengo Hospital. We are discussing some of the challenges that are attributed due to self-medication. I myself am a parent, but things that I complain about, when you take your child to the hospital to be checked, whether it's malaria or typhoid, they tell us bacterial infection. I think we shall get a topic. My producer out there. Bacterial infections, up to now, parents have not understood. And I believe someone who's watching me up to now, they're like, it's also Twazuko. So that's why we run to self-medication.
You've even added bacterial, but the word is always infection.
Infection, yes.
It is. And it is a very problematic word. Infection, and now like where I work it's a referral center, so we usually get those kids, people who have been mismanaged in the clinics all day, whole night, and then they come when they are ready. Very bad love. And all the parent, all the caretaker will tell you, we have been at clinic A, and they told us they were treating this infection. So sometimes sitting in the clinical room, a parent comes and is like, I want to check my child for infection. And then you are like, Madam, what is infection? Like, you are the people who tell us.
You're the ones who tell us.
You are the ones who tell us that every time I come here, the child has infection, child has infection. But to put this in context, I think some people are disguising under infection. To at least get some money from you. At least they will let them give you some medication for the infection, and usually they misuse ceftriaxone. There is that injection called ceftriaxone, and you find that most people know it safe. They know it as safe. Safe. So safe and infection are also like this. So
sister and brother.
Yeah. So in medicine, we practice in a way that we recognize patterns of diseases, because most of the diseases have a similar set of symptoms, but there is always one discerning one, or at least the sequence of events will direct you to point A rather than point B. But in some facilities where they don't have, or probably the person you are dealing with doesn't have expertise enough, they will be like, if they check and the child doesn't have malaria, doesn't have typhoid, that is infection. Like, he has infection, let's just treat the infection. And it becomes a problem, because even bad conditions like leukemia, like cancer of the blood, they present with symptoms that are exactly like malaria. So some of the kids actually come with these leukemias and at very bad stages. And you know, you can no longer really do much, but they have been treated for malaria and typhoid down in the clinics for a long time. Another clear example could be chest conditions like pneumonia and all that. Usually when you have problems with coughing, chest pain, the chest has the lungs, yes, but it also has the heart. And very many people have cardiac or heart problems that are causing them to get these cardiac coughs, chest pain, but they are in the clinics being treated for pneumonia. You get, so they have gone to the pharmacy and they're like, I'm coughing, I have chest pain. So they give them antibiotics.
Very true.
Yeah, so by the time they come to really diagnose the true problem,
there's no way you're starting from.
Yeah, it is worse than where it would have been.
And that brings me to where I really wanted, but you have now already tackled how it affects you professionally, the health sector. I see doctors now, you start struggling to know where it started from. Now you start telling a parent that it's high time or I don't know, it becomes hard for you as well, doctors, and I believe every parent out there, it is a wake-up call, I think, to always run to the hospital to seek medical attention before you self-medicate. I wanted to ask something with drug interaction. Is there a way as well, do we also define it as self-medication?
Okay, drug interaction is a way that the chemicals that are within these various drugs interact or relate with each other.
Okay.
And putting it in the context of self-medication, it would come out clearly for patients that have chronic diseases or have chronic medications they are taking daily.
Okay.
So you may be hypertensive, or you have high blood pressure, you are diabetic, or you have other chronic conditions for which you take chronic medications daily, and you get another interjecting illness or ailment, and you're like, let me go to the clinic. Oh no, let me go to the, usually they go to the pharmacies or the drug shops first before they go to the clinic, and then
the hospital.
the bigger hospital. So you go to the clinic, they give you a certain brand. Nowadays, the brands that are on market are a lot of combination of medicine. It is very hard to find like Panadol that is just Panadol. Most of them now are combination. There is a Panadol and some class of drug, so they are combination drugs. So you don't know how these drugs probably are going to interact with the other medicines you are taking. So some drugs, when you take them with others, they reduce the absorption rate of those drugs. So you don't get to obtain enough of the dose, however much you've taken the medications that you're supposed to take them. But also sometimes you find that in the liver, where these drugs are broken down, that enzyme system and all that, one drug may affect the enzyme that is supposed to break down the other drug. Then it becomes too much in the body, and it becomes toxic in a way, because it was supposed to be broken down, but the other drug you took interfered with the process of breaking it down. So you continue taking the other dose, it accumulates, and you get, now it's like you've taken an overdose unintentionally. You get, so it can happen in that way.
Well, that is, Dr. Kanyika, I'm excited. I'm loving this one because I can relate. I'm a culprit for self-medication, but today will be my last day. It is Health and Wellness. Dorothy is my name. We're talking about some of the challenges that are associated with self-medication. Every Saturday, we do have a topic that we tackle that you out there, you would relate to it. And you could watch us live on Bethany TV, on YouTube, UG, Facebook and Twitter, Instagram. We are also there. Go follow, like, and we shall, give you the best feedback. Now, as we're talking about the self-medication, the missing of drugs and, left, right, center, I would want to know, what are those psychological, emotional challenges that are faced with self-medication?
Are
they there?
Thank you so much. Emotional and psychology, I could dwell more on the psychology bit. Like I told you, I will still draw on an example of this cough flu, the common cold. Like I told you, they are caused by viruses, and the body eventually fights the virus, even if you didn't take that antibiotic.
Doctor, there is this flu that is around.
Yeah, you know, I'm not saying that all cough and flu is viral, but I'm saying the common cold, of which you will not really know that it is common cold unless you've been assessed by a doctor. You've done some tests, and they're able to rule out that I think this is just common cold. Just give you supportive medication, advise you, and you go back home without having to misuse the antibiotics. But because eventually the body will clear out the virus, somebody takes these drugs, they get healed, and they really believe psychologically that it is that drug that has
I'm now
helped.
okay.
Yeah, it's drug that has helped them. So they'll always run to it. And what is very interesting and surprising is that, yes, we have Google nowadays, and we have a lot of Google doctors, Google parents,
on Twitter,
and all that. So most of these parents, especially in the private settings, the bit of the literate and the learned and all that, they come when they have Googled.
Yeah.
So you clerk them, discuss, in the end you write medications, they look through them. Nowadays we don't write those
those funny handwritings.
incomprehensible ones. Yeah,
Yes.
of course you'll be able to read and see they have given me this drug if you are interested in knowing anyway.
Yes.
So they are like, doctor, why haven't you given me drug A? And you are like, why do you want drug A? Either they have ever taken it. This drug always works well for my kid. It is the one that works for them. And then all they will tell you, I think I read, and they were saying this is the best medication for this particular problem. Or they will specifically come and tell you, I want a green syrup. So there is one whom I encountered, and we really set off at a very bad pace, but became friends at the end of it all, because for them, they didn't come to explain to me the problems they had, actually the kid had, but they came to get a particular syrup, which they didn't know the name, but all they knew that it was green. And then I was like, is it a green cover or the content is green? Like, doctor, I should be knowing the drug.
Yeah, you have
when I tell you it is green, you should know the drug I want.
Yes.
I'm like, what does the child have? Like, I want the green syrup. So we have those really psychology, like it can affect the psychology of a person, that even if probably you've given them the right medication, they're not going to take it as they're supposed to, because they feel you've not given them the other one that that works on them. And psychology plays a very important part in the healing process of a person. So yeah, it really does cut across the psychology part of it as well.
I know one who's watching could be wondering why I'm so happy today, because I'm a culprit.
Yeah, we are all culprits. But even as the doctor,
I have issues with pharmacists. I'm like, I want that word. I want that word made from England or made from where. But I've seen people who take drugs with alcohol, doctor. Is that also what we're discussing? Is it also an effect or a challenge as well?
Yeah.
And if someone is there thinking that it's cow, because they would take like in the morning their proper medication, and in the evening, it is time to go and have fun. But I mean, this medication and alcohol, I believe they don't relate at all.
Yeah.
Yes.
Because alcohol is a chemical.
It is.
And the drugs are also chemicals. So definitely there are those medicines that will interact with alcohol. And there are actually those medicines that we particularly use to get people off alcohol. And the way they work is through that interaction. When you take alcohol, it is also broken down by a particular enzyme, and it creates, it produces a very, very bad chemical. Usually that gives people hangover, that vomiting, that bad feeling. Sometimes people get when they overtake. So there are drugs that actually interact with the enzyme that is supposed to remove that toxic chemical that comes out of the broken down alcohol in the body. So when you take such drugs with alcohol, they are going to increase the toxicity of the alcohol, and it is going to be problematic to you. Sometimes we use them so that when a person takes, they get that very bad experience, so that they never do it again. Yeah, but you may take it inadvertently, and you get those unnecessary interactions. So it is better to get the advice of a health professional, because there are those drugs that will tell you, take them with food, take on an empty stomach,
Yes.
take this with milk. This one you should take with water, don't take with milk, because of those various interactions, especially
I understand.
with the absorption.
Okay, now speaking about self-medication, I wouldn't want to miss out the vulnerable. That we're speaking about the elderly, the children, and the pregnant mothers. I believe pregnant mothers and children,
Yeah.
the vulnerable, the bad days, they always want to get their specific medication that they know. But what are those also challenges that they face as, you know, vulnerable as they are?
Yeah, thank you so much. I especially want to dwell on the two close parties, the children and their
Pregnant
mothers.
yes.
The children, it is always an issue of overdosing and wrong medication because of the nature of their body. Their bodies are growing. Most of their physiological or internal processes are building up. They don't work like the adult systems. And in medicine, there is something that we always want to say, that children are not young adults.
Sure.
Yeah, so that if I take this Panadol, 2 tablets, let me give them the very quarter. I'm using Panadol because that is the easiest drug that can understand, but of course children take it, but there are those drugs that wouldn't give them simply because the adults also take them.
True.
Then you say, if I'm taking it full tablet, then probably let me break it into quarter and give it to the what? To the child. Because they have components that are not going to work well with their growing systems. There are some drugs that interfere with growth rates of their bones. So you give it, it interferes with it, so you put the child at a stake of, you know, being shot. And you know, we are in an era of you know, tall people, American height and all that. So anyway, that is a by the way. But you know, these drugs will always have challenges with the physiology and internal systems of the children.
Okay.
So you find a child has been brought in, they're drowsy, unclear history, but when you go to dig deeper, you find they have been given some inappropriate medication. And some people go on to give cocktails of medicine to as young as 1 month.
Call them cocktails.
Yeah, they are always, it is a cocktail because they always want the mix.
True.
So they bring to you a 1 month old, but they have, you know, given them this cocktail medication, and usually, you know, they squeeze it on the spoon so that, you know, it turns into liquid, and they give, and it is really a problem. So sometimes they get overdosed, but other times they take inappropriate medications and get very bad side effects.
Very true.
But for the pregnant mothers, the problem always comes with the growing fetus inside your womb. It is what we are really very concerned about. And in medicine that we use, we categorize them into certain categories, whereby there are those that are in a category where you know that they are not supposed to be given to pregnant women all through their trimesters or the month of pregnancy. There are those that you are not supposed to use within the first month, and you can use them later, but still with caution. But the problem always comes with the first month. And unfortunately, these are the months that most ladies don't even know that they are pregnant. You get, some ladies really get to know that they are pregnant like 2 months. I don't know, I'm not a lady, I don't know how possible that is, but some don't know.
They do.
And for us, we always consider each and every woman pregnant until you have proven them not to be. Because when you're 1 week, 2 weeks, you may really not know that, you know, I'm pregnant. And this early stage is when most of the critical parts of the human being are formed. And the process is very intricate, very delicate, that if anything interferes with it, that is a fetus that is going to form with deformed eyes, with deformed ears, no legs, short legs, like all the weird things that you've seen, like babies can have. So you take these drugs unknowingly, then before you know, at around the terminus of the pregnancy, you are doing a scan and they're telling you the baby you are growing may not survive, or is very deformed, you may want to terminate them, or what, and that attracts some social context. You know, in our African culture,
True.
then you're like, in our family, nobody has ever delivered such a child.
True.
Maybe this woman is cursed, they have a bad omen and all that, and you know, you see how it widely affects us in so much ways. So you know you are going to bear this, but unknowingly you just use certain medications or certain herbal drugs or what that you shouldn't have used when you were early in your pregnancy, and it affected the way this baby grew. But you don't really have a bad omen, or probably there was really nothing else to explain why you had such a child. So pregnant women, or particularly women of reproductive age, you know, you are having unprotected sex, you are looking for a child, you should be very conscious about that growing child in you, especially in the first month, which women actually don't give attention, because even coming for antenatal, they want to come like at 4 when that belly,
is showing. Now, as we are about to wind out, have few minutes, like 15 or 10 minutes. How long does it take for, as I've now taken self-medication, how long do I get proper medication? Briefly.
Sorry?
How long does it take for me to now leave I've been self-medicating, but now started the proper medication? How long does it take for my body to adapt to the new proper medication?
Per se, it's not really an issue of the body adapting after you have misused the other drug. But if you've been misusing a particular drug, you want to just pray that actually you've not created resistance to some of these microorganisms, or actually you don't have now that microorganism that is resistant again. But otherwise, if you have misused the drugs over time, and then you come with a resistant microorganism, of course we shall first try you on the first lines and all that, but it reaches a point, like a breaking point, where like, no, I think we need to grow some of these microorganisms in the lab and test the different drugs on them, which we call couch and sensitivity. So if we have really given you like first line, second line, third line, and now we are aiming at the big shots, we will have to first draw blood. Either you shall take your urine or swab your vagina or anything else to get a sample, grow these microorganisms in the lab, then go test on them drug A, drug B, drug C, to see particularly which drug should we give, instead of giving what you've already been taking for a longer time, yet still you will not have the effects at the end of it all.
All right. As a doctor, what role have you played to ensure that we avoid this self-medication? Of course, by having you here, it's a +1. But out there where cameras are not there, what are you doing?
So me as a person, I take caution, especially to explain to the mothers, where in the case where I'm seeing children on the tests that I've done, and actually explaining to them what we mean by that infection bit, and why I'm giving them the drugs that I'm giving them. And I usually want to specifically delineate for them what kind of infection we are dealing with, that this is viral, so you are not going to see me giving your child this and this and this because they don't need it. You will need to prepare them psychologically and actually make them believe that 1-2 drugs you've given them that actually supplement supportive things are going to do well with their kid, vis-a-vis the antibiotics and everything they were expecting. And I love it because most of the mothers have done this too. The next time they come back, they clearly very well know some of these tests, those complete blood tests. They can look at them,
Okay.
and they are like, the other time the doctor showed me here, these numbers were very high. So that they gave the child what? This drug. Now this one, and they will be very critical to see this one that has high, this one that has low. You get, sometimes it gives them their confidence that they need to go to the hospital and do tests to get the proper medication rather than just going, because now they know things can be different, and when they are different, the drugs are also different.
All right. Thank you so much, Dr. Kanyike Andrew, all the way from Mengo Hospital. We have been discussing about challenges with self-medication. Hope you have picked one or two. We would like to wish you a very good night. See you next week. Bye-bye.
Bethany TV for health.